judge. So Dr. Escott, I think I saw you on there. There you are. You want to go ahead and give us your briefing on COVID?
Yes, sir. Thank you, Judge. I'm going to share my slides with you, and I hope that you can see that.
Yes.
Perfect. Again, thank you, Judge. Thank you, Mayor, for the opportunity to update you both regarding our COVID-19 response in Travis County. This graph I'm showing you is an update of our Travis County cases by date. The yellow line again showing the 7-day moving average of those new cases. Yesterday we reported 104 new cases with a moving average of 120. That's a 50% decrease in the moving average in 1 week. So again, significant improvements regarding our case numbers here locally. This is an update of our admissions to the hospital. Again, this has been our key indicator for transition of stages of risk. Yesterday, we reported 31 new admissions to the hospital with a moving average of 29. Last Monday, we entered into stage 3 territory. We had 4 days of declining cases, and unfortunately, the last 3 days have been increases in cases. So the net is no substantial change in our moving average of admissions since a week ago. This graph is showing 3 things. The blue is our total hospital beds being utilized for COVID-19 patients. The orange are the ICU beds. The gray are our ventilator beds. Our hospitalizations yesterday, 228 with a moving average of 232. That's a 15% decrease over the past week. Our ICU utilization, 72 yesterday, moving average 71, a 24% decrease in the past week. And our ventilator usage, 55, with a moving average of 52, a 20% decrease over the past week. Again, on all 3 of these measures, you can see either flattening or a slight increase in the past couple of days. So again, we're going to keep monitoring these numbers this week, and I'll talk more about the overall picture here in a little bit. When we look at the projections provided by the UT Modeling Consortium, we have seen some flattening of the projections as compared to a week ago. They haven't updated the projections in the past couple of days. So right now we're still seeing a downward trend. According to this model, it suggests that we will enter into stage 2 territory around April the 4th. However, with the increase over the past couple of days, I expect that this projection, which may be updated later today or tomorrow, will flatten out and will not show us a path, at least through the first week of April, of stage 2. So again, we'll continue to monitor these projections as well. This is the projections of total hospital bed utilization. When we get out to the first week of April, projection right now is that we'll drop below 100 hospital beds being utilized for COVID-19 patients. Similarly, we see a decline expected in the ICU utilization, with the projection now suggesting that we'll drop below 30 in the ICU usage by the first week of April. Again, what these models show us is if disease transmission stays the same as it is now, if those protections stay the same as they are now, we're going to see a decrease. Obviously, there is some concern about how that's going to change after Wednesday. With businesses opening up 100% and with relaxation on the mask mandate. Again, if the community responds by taking a lot more risk, these graphs will move in the other direction and we'll have a third surge. So again, if we want to see this reality, we have to continue the protections that we've been doing for the past month to further drive down those case numbers and transmissions. This graph is an update of the hospitalizations by age group. We did see a increase in the percentage of individuals in the 80-plus age group hospitalized last week, decrease in the 60 to 69 age group by a significant amount. Also increases in the 20 to 29 and 30 to 39 age group in terms of percentages of the hospital, of those individuals hospitalized in the last week. So again, some movement in who's getting hospitalized, which I'll talk more about on this slide. When we look at the difference between 2 weeks ago and last week, there's about a 20% drop in overall admissions for the week. So that's good news. It's great news. We did see an increase from 25 to 32 in that 80-plus age group who were hospitalized, decreases in the 70 to 79, 60 to 69, and 50 to 59 age groups. So we see a lot of compression in that in those older age groups, again, which is good. We know that the older you are, the more likely you are to have a severe course, more likely to need ICU admissions, and certainly more likely to die from COVID-19 as well. What is concerning, however, is the thickness of the bars that you see in the younger age groups, that 20 to 29 and 30 to 39 age group in particular. Again, we need lots of disease transmission in those age groups to net 44 admissions between those two age groups. So again, even though younger people in their 20s and 30s may not have as severe of a course on average, it's important that we continue to promote disease prevention in those age groups, masking, distancing, and personal hygiene, because we have seen in previous surges that it starts with those younger individuals and then spreads to the older age groups, which has more impact on morbidity and mortality. This graph is showing an update of the hospitalizations by race and ethnicity. This week, or for last week, 42.4% of hospitalizations were in our white non-Hispanic group, 41.8% in our Latinx population, and a significant decrease in our percentage associated with African Americans, moving from 15.9 to 11%. So very pleased with that change in particular. When we look at the overall admissions broken down by race and ethnicity, again, you can see in the green our Latinx community, a significant decrease, 87 to 76. You see a decrease in our white non-Hispanic, 84 to 79. And then a big drop in our African American community, moving from 35 admissions the previous week to 20 admissions last week. For some more positive news, this is our overall positivity in our community for COVID-19. Last week, 4.6% positivity for our data set that is collected in Austin Public Health. So a significant decrease as compared to 6.9% the previous week and 10.3% the week before that. Again, I want to reiterate the importance of testing for COVID-19. There are lots of symptoms which can mimic other diseases. If anybody has any of the symptoms associated with COVID-19, it's important to get tested. The better we can do at detecting COVID-19 and isolating folks who have COVID-19, the better chance we have of further driving down the positivity and the hospitalizations and deaths associated with COVID-19. This is a breakdown of the positivity by race and ethnicity. Our Native Hawaiian and Pacific Islander group moved from 23.1% the previous week to 20% last week. Our Latinx community, 13.4% the previous week to 8.4% last week. Our African American community, 6.9% the previous week to 4.9% last week. Our American Indian, Alaska Native had an increase, 5.7% to 6.9%. Our Asian American community, 4.4% the previous week to 2.6% last week. So that's the one group in particular, who's doing the best right now in terms of positivity, under that 3% threshold that is our major goal. Our white non-Hispanic community, 5.6% to 4.1% last week. So by and large, the improvements across the board in terms of race and ethnicity and our positivity for COVID-19 testing. Similarly, when we look at our distribution of positivity by age group, we see across the board decreases in positivity, with the exception of our 80-plus age group. Again, smaller numbers of individuals being tested. They are the highest this week so far, and we'll continue to monitor that situation. But we're seeing drops across the board, generally speaking, with some age groups approaching that 3% mark, and we've got many who are close or below that 5% threshold. When we look at the positivity in our school-age children, the story is a bit varied. Our high school positivity for the past week, that's 228 to 36, 5.3%. Middle school, 8.7%. Elementary, 4.3%. And our preschool, 5.9%. Again, we're pleased to see the TEA and our local school districts continuing the mask mandate, continuing the protections, including the distancing and the hand hygiene. And again, if we continue to do those things, we'll continue to decrease the positivity in our school-age children. Again, we'll continue to monitor the situation. We continue to meet weekly with our superintendents. We have a schools-related task force that is working closely with the school districts to monitor disease transmission and ensure that they have the resources they need to address any transmission that may be happening on campus. For some great news, this is our dashboard associated with our long-term care facilities. You'll see that in the past 14 days, there's been a total of 10 cases, and that includes staff and residents. 36 in the past 28 days, so remarkably low cases associated with long-term care facilities. I'm not certain, but I feel fairly confident that these are record low numbers for transmission in those facilities. And again, I think this has a lot to do with the focus from the federal, state, and local governments on getting these folks vaccinated early. I think we are seeing an impact of that focused vaccine effort, and it again is saving lives in these facilities and certainly helping to contribute to the better situation in our hospitals. Quick update on our regional infusion center. Again, this was opened in conjunction with the Texas Division of Emergency Management to provide monoclonal antibodies to residents who are at higher risk for severe disease and death from COVID-19. A total of 730 individuals so far have been treated through this facility. Currently, we have much more capacity to provide the treatment than people who are getting it. So as a reminder, we're sending communications out to our healthcare community to ensure that they are referring individuals who may qualify for this. Again, COVID-19 is still around. It's still dangerous, particularly for those who have risk factors for severe disease. So we need to continue this effort to push folks there to receive this antibody therapy, which may decrease their risk of needing hospitalization. Also want to update you on our alternate care site. As of yesterday, we had 28 individuals still hospitalized in the alternate care site at the Austin Convention Center. A total of 187 individuals, in addition to that, have been treated and discharged from the site. As of yesterday at 5 p.m., the alternate care site is no longer accepting new patients, and we will begin the process of demobilization of the facility with the expectation that all the individuals who are currently being treated there will be dispositioned by the 20th of this month. Again, we will continue to have the resources available should we need to stand it up. the expectation from the Texas Division of Emergency Management is that if we need to stand up this site again or a different site for an alternate care facility, that it would take about 1 week from the order to being able to serve patients. So again, we're grateful for the partnership with TDEM to provide this service and in the future as well if it's needed. So quick updates on influenza. Again, very low numbers of influenza thanks to the vaccination efforts, the masking and distancing and hand hygiene efforts. Our positivity last week, 0.44%. One single influenza case identified in Travis County for week 8. To date, 1.17%, less than 100 positive cases of influenza so far in Travis County. When we compare that to the previous 3 seasons, we see that we are still in record low territory. So again, we are pushing past the major peaks. There's still some possibility of seeing flu into March and early April, but that risk is certainly dissipating quickly. Finally, Mayor and Judge, we've discussed the possibility of transitioning to stage 3. We've been in stage 3 territory for the past week. And to the commissioners and council, I'll say that I sent a text out to the mayor judge this weekend expecting that we were going to transition to stage 3 today. However, given the fact that admissions are on the rise for the past 3 days, that we've seen plateauing and some increases in our hospitalizations, as well as the concern about over-relaxing our mitigation efforts with the removal of the mask mandate and potentially as we head into spring break next week, I've got some concerns about doing that at this stage. We will continue to monitor the data. If there is solid indication that we are decreasing in our admissions later in the week, we may make the determination at the end of this week to transition. However, for now, we're going to stay in stage 4 to ensure that we continue the advocacy and the efforts that got us to this stage and need to continue at least for the short term. So as a reminder, we're recommending folks stay home to avoid non-essential trips, to continue the masking and the distancing. We're recommending our businesses operate at a maximum of 50% capacity at this stage to help ensure that spacing, to ensure that if people are going out to restaurants or retail, that they can do so in a safe way. Again, our effort is to preserve public health and the economic health, and by finding that appropriate middle ground, we can do both things well without taking too much risk on either side. And finally, I want to share with you all a joint statement from lots of the area entities, healthcare entities, public safety, and others that really codifies the importance of masking. We believe in masking. We know it works. We saw the dramatic impact that the masking mandate had when it was issued by the governor on July 2nd, with almost 2 weeks to the date, a substantial and sustained decrease in transmission. We need that to continue. We need the efforts to continue. We need people to continue to mask and distance and do those things that have gotten us out of surge here in Travis County. So our hope is that people, our community, our elected officials will continue to echo the messaging that these protective measures, these non-pharmaceutical interventions work, and they're important for us to continue. With that, I'll transition over to Director Hayden-Howard.
Good morning. Next slide. So we wanted to spend a little time talking about the scheduling system update. one of the things that we made a change is that we have moved to a Monday release of appointments. One of the concerns that we were receiving is that the Tuesday, Thursday didn't allow as much flexibility, and folks wanted more than a 24-hour turnaround to come to appointments. And so on yesterday, folks, our team worked together to release appointments yesterday. We released 10,700 appointments, and so those were scheduled. All of our sites were scheduled through the week, through Saturday. And so the goal is that as we are watching if there are any level of no-shows, our goal would be is to go back in the system on Thursday and release additional appointments for the remainder of the weekend. That is going to be the process that we're going to continue to do and see how that works. And so we did receive some positive feedback. I actually sat with the team last night as we released the appointments, and was able to watch the team interact with folks. They are typically looking at comments on Facebook, Twitter, and Reddit. And so they are actually answering questions as they come up, as folks are online at that time. And so it's definitely a process. We're continuing to do some additional upgrades and looking at other ways of how we can improve the system. Next slide. We have provided, and just as a reminder, this is more of an on-time snapshot. The vaccine dashboard was updated a week ago, so that data is a week out, and so this is as of March the 6th. We have provided 112,948 vaccines. This includes our first and second doses. One of the things that we continue to do is to provide the Moderna vaccine into our community. And so at our current footprint of operating 5 locations, we have the capacity to operate and to provide 37,000 vaccines a week, including that existing footprint. If we increase the hours of operations in those existing sites and potentially add one more, we are looking at Burger Center for a location in March. And so adding that site could potentially bring us up to 46,000 vaccines. And so we're definitely, kind of looking at the various scenarios. And so I want to share some additional information as we proceed through the presentation. Next slide. As you all know, we have introduced the concept of school Saturdays. As of last week, we were informed by the Texas Department of State Health Services that all eligible school staff as well as childcare folks are eligible to receive the vaccine. As you all may recall, we actually did a school Saturday in January on the 30th. And so prior to this process of adding, what we had done is that we were working with the school district's public-private charter, and we were able to provide vaccines for 4,300 folks. So after we've introduced this concept, we have provided 5,500 school staff, and we have provided 2,168 childcare employees. We will continue to work with them, always encouraging other partners to look at doing school Saturdays because we know that that is a pretty large population. As of the 8th, as I shared with you at the last presentation last week, wanted to just share some data with you. 69,770 people, 65 years of age or older, have received their vaccines through Austin Public Health. As we have, made some modifications, making outbound calls, and proactively working with seniors, whether it is through our nonprofit partners that we receive referrals from, continuing to work very closely with them. In addition, we have our mobile team, and the mobile teams are basically, we have vans that our folks travel to locations, and we are using fixed facilities where we are going. And so basically with the mobile teams, this week we are finishing the Housing Authority, where we will have completed 4 properties of folks that are seniors and or that are disabled, working with ADAPT. We also have started working with Foundation Communities as well. One of the things that from an equity perspective, we have started our meetings with our faith-based initiative. Our staff are starting to have a three-pronged process where it definitely talks about the education, but it moves to the ability to sign up and to provide vaccines, working with faith-based locations. We are partnering with UT Dale and community care, as we have done with surveillance testing. They are assisting us with providing vaccines at protective lodges and the Arch. And so we will continue to do those things, as well as other partners that provide services to folks that are homeless. Next slide. This next slide just kind of moves us into strategy options to herd immunity. And so basically what we wanted to share with you is a couple of scenarios. This first scenario will show you that if Austin Public Health set up locations that were able to do 25,000 vaccines a day, and the illustration is using Moderna, it would be a 16-hour clinic. It would require 2,400 staff a day. We are estimating the salaries, kind of based upon, starting with a livable wage. So it will be between 1.8 and 2.5 million a week for salaries. And as you all know, we have a contract. And so it depends on if it's a walk-up or if it's a drive-through. The cost for that is between $400,000 to $800,000 a month. And so basically 85% of Travis County residents would be provided the vaccine in 8 weeks. The other thing that this model has to keep in mind is that it has to keep in mind the second doses. That is, you always have to plan for that. So there could be the potential of providing 50,000 vaccines a day based upon providing the second dose. Next slide. This other slide, puts us in more of a partnership perspective. We are really grateful for all of our partners in Travis County. And so this is a public-private strategy. So as we look at this public-private strategy, if Austin Public Health maintained at 24,000 a week, considering if we were using Moderna, then basically with the approved sites, all of our partners would only need to do 267 vaccines a week. And so basically no additional hours or no additional staff would be needed because basically the partners would be able to do that. And so the timeline for that would be, we'd be able to get that done in 12 weeks. And so one of the things I, want to just give you an example is that HEB, Walgreens, Sam's, and Walmart and CVS have a direct contract with the federal government. And so in conversations with HEB, for example, has the ability to do 4,000 vaccines per day at 40 sites. And in our conversation with Austin Regional Clinic, they have the ability to do 30,000 vaccines at 30 locations in a month. And so as you can see, as you add more providers that will be able to receive vaccines in our community, this equation will be cut in half. As you all know, the current administration has talked about providing vaccines and have them ready to distribute in May. And so in the current scenario, as vaccines are starting to come into our community, this equation totally changes, because what we've seen in the past is that the Austin Public Health begins to shift its focus and starts to provide to vulnerable populations, and the private sector tends to do a little bit more than the public does, only because of their existing infrastructure and the number of sites and capacity that they've had over the years. Next slide. So when we think about equity and best practices, the things that we know have really, really worked is because we will get to a point to where we have more vaccines and people that are not wanting to have a vaccine. And so we want to make sure that we are working with hesitancy. As you all are alerted, we have our 8 organizations that are working very closely with Austin Public Health, as well as our in our community, to be able to get out, to provide the education and start those conversations. One of the things that we are wanting to pivot to is being in non-traditional settings. As I stated earlier, the mobile team is currently in non-traditional settings. We are partnering with our HACA sites as well as foundation communities. We've met with Family Elder Care to be able to go to Lions Garden, et cetera. And so being able to be in non-traditional locations. We've also, in our conversations with the faith-based community, we have identified 3 pastors that are willing to be a host to provide vaccines. In another conversation that we've had, there's other community partners that are definitely interested in also providing services in these locations. And so we are just definitely looking at our strategies, and our goal is to get us to herd immunity, but we also want to make sure that we are providing the best service that we can. With that, that completes my presentation, and I'm available for questions. Thank you.
Thanks. I'm just going to give a quick summary of the Circuit of the Americas stuff, because I know some council members had asked kind of about what that looked like. So this past weekend, we gave 10,000 vaccines at Circuit of the Americas. And again, it was through community care, mainly community care patients, although we were able to include about 420 Del Valle ISD teachers and staff, as well as about 1,000 AISD teachers and staff over the weekend. And then I think at this point, we have gotten all of the, from previous clinics, and I think with a few this past weekend, gotten all of the 65 and over staff of Pflugerville, Manor, and Del Valle, and AISD, I believe, at this point. So I think working obviously with Austin Public Health, I think in pretty short order within the next week or two, I think we should be able to vaccinate all teachers and staff who want to be vaccinated in short order. Let's see, so this weekend we gave the Pfizer vaccine, and just a couple highlights there. It basically doubled the pharmacy staff that we had to have. Pfizer, I don't know if comes in a vial that originally was a 5-dose vial. My understanding is the previous administration at the federal level sort of upped that to 6. And I think you can often get 6, but not always get 6 out of that. And in addition, you have to mix it with saline to prep it. You have to, which results often in the people who are prepping it having to sit there and flick the what is that thing? The needle, the syringe. Thank you, Commissioner Howard, to get the bubbles out. So it's a much longer process. Community care took care of that. We actually had helpers from a local grocery store chain that was awesome. We also had people from ESD 11 helping with the pharmacy part, but that's a much bigger lift with Pfizer than it is with Moderna or, hopefully, I don't know how Johnson & Johnson is set up, but I think we're all hoping that we can get those in the future. So I think total in the clinics that we've done with community care, we've done about 14,000 doses. The vast majority of those have been community care patients. Looking in talks, obviously, with the mayor and Austin Public Health, trying to figure out if we can get back to just sort of one large effort that's coordinated all together, and I think we're heading that direction. We've had over 1,000 volunteers at the Circuit of the Americas clinic so far. It's really astounding to me how much of it we've been able to do just with volunteers. Obviously, some paid staff, both from the county, from community care, and from Ascension Seton, somewhat, but most overwhelmingly volunteer-driven. I think the potential for Circuit of the Americas, if we can get up to full capacity and get all the vaccines that we want, again, hopefully Johnson & Johnson vaccines, but I think we could get up to, if we're doing it 7 days a week, close to 50,000 a week is what our goal is. I think obviously right now, next weekend, for example, we're going to have 14,000 doses. So that would be 4,000 Friday, 5,000 Saturday, 5,000 Sunday. I think we're looking at doing Saturday, just like Austin Public Health is, as a day focused on educators and staff at the ISD level. So my math on that was that it would take us, if we're trying to get to the populations of Travis, Bastrop, Caldwell, and Hayes counties, somewhere around 16 weeks. So I think I need to get together with Director Hayden-Howard to figure out what I'm calculating incorrectly. But I think with the combined effort of what Circuit of the Americas is doing, with what Austin Public Health is doing, HEB, CVS, all the hospitals, I think we're really starting to get a capacity to give out lots of vaccines. And I think that still the common denominator across all of it is we're hopeful that we get more vaccines across the board for the region. And I think all kind of hoping that we can get Johnson & Johnson, because that in effect doubles our capacity. We don't have to do a second shot with Johnson & Johnson. So that really, that literally doubles the capacity that we have. So I'm also happy to answer any questions, but let's turn it over to Commissioner Gomez and work our way through the Commissioner's Court for questions for Dr. Escott or Director Hayden-Howard or on this effort.
Judge, I don't have any specific question. It sounds like it's the vaccinations are starting to move forward, and that's what really is going to make a big difference. And then the bishop issued a letter, which I think is a very positive message to people in the pews that it is essential to get a vaccination, and simply to lend support to human life and human dignity, and so I think that's going to be just a tremendous positive note to move forward. And so that message will continue to get out. But it sounds like we're finally on that roll to try to get as many people vaccinated, and that's a real positive issue. So thanks very much for all that you have done to get this process moving forward.
Thank you, Commissioner Gomez. Commissioner Shea?
Thanks, Judge. And as usual, thanks to all of our staff that are just working incredible hours and making an amazing effort to try and keep the community safe. I have kind of a two-part question. And I do want to talk about the cost of these mass vaccination efforts, but Andy, Judge, we can have more of that conversation in our county meeting. But I am hearing alarming stories about second infections from people who had tested positive for COVID, had gotten it previously, and then are getting reinfected months later, in some cases very, very seriously. So I wanted to ask about that. But my other question concerns the governor, I think, recklessly lifting the mask order and saying Texas is 100% open, full steam ahead. I'm extremely concerned about spring break, St. Patrick's Day, one of my personal favorite holidays, Easter. I mean, these are big events coming up where people gather in large numbers. And I'll just tell you, we've been trying to make plans for a very large national conference here, and the national staff were incredibly alarmed that the governor had taken this action. And they said that changes their thinking about planning for this large convention this summer, because it raises their concern that there will be a greater rate of spread in Texas. So if you could speak to some of that, that'd be really helpful. Thank you.
Commissioner, I'm concerned about the impact of the executive order as well. I think we all are. Speaking to my colleagues, my physician colleagues, hospital administrator colleagues, our superintendents, everybody's concerned about what's going to happen next. Everybody seems to be on the same page that this seems a bit too soon and a bit too aggressive for where we are in the pandemic. I'm grateful that the governor has reiterated the importance of masking, the importance of distancing over the past several days, but my concern is that what people will hear is you don't have to wear a mask and everything's open 100%. That's the wrong message. The message is we've got to continue those protective actions. We have to continue the masking and distancing and hand hygiene. We have to continue to avoid large gatherings so that we can drive down transmission. I think this certainly leaves us open to a real possibility that we thought, just a few weeks ago wasn't going to be realized, and that is a third surge. But as you pointed out, relaxing now, followed by spring break, Easter, St. Patrick's Day, and a number vaccinated, which is not anywhere close to herd immunity, certainly leaves us open for a third surge here in Texas. I'm particularly concerned about this action really before essential workers are even able to get vaccinated. We saw that school staff was added after the fact, but I think we need at least another few weeks, another month to start thinking about any aggressive reopening, because we need to vaccinate those folks who are going to be face-to-face with customers, who are going to be at higher risk for contracting the disease. And, because many of them are from our communities of color, they're going to be at higher risk for severe disease and death from COVID-19. So our community needs to understand that we have to stay protected. We still have health authority rules in effect, which require masking in businesses throughout the city and the county. Those things will stay in place. The enforcement of those will stay in place because we have to continue to protect our community so that we can save lives.
Any thought on the reinfection rate with the variants? Are you seeing a rise in that?
Commissioner, we certainly have seen many reports of reinfections with variants. We know that the role of variance is increasing in Texas and around the country. And again, this is more evidence that suggests that we should be more cautious right now so that we can decrease the risk of the variant transmission. In addition to that, probably more concerning is the creation of new variants. We've already seen this in the news this morning out of the Pacific Northwest. The more the variants mix with the original strains, the more likely it is that you're going to create further mutations, which likely will start to be more able to evade vaccine. Again, we're at a critical time spot right now where we have to continue those protections to avoid the impact of the current variants and potentially new variants.
Thank you. Commissioner Trevelyan?
Just a couple things. Number one, I appreciate the candor and the clarity of your last answer. It's really important that when science guides us in one direction, that we don't allow politics to guide us in another direction without calling it out. So I appreciate the clarity and the candor of your answer. Secondarily, I want to publicly thank you and Director Hayden-Howard for the work that you did with underserved communities to make sure that churches were being reached out to, fraternities and sororities were being reached out to, folks who are not normally a part of the discussion. I appreciate the efforts that you made. I think they were important. I think they paid dividends last week and will continue to pay dividends for the community. My concern is, once again, as we talk about essential workers, I'm particularly interested in making sure that we have our teachers in our Title I schools covered. I know that we just opened up the call last week for teachers, but I'm particularly interested in teachers and kids that operate in the Title I environment. And my question is, have we considered using our mobile teams to make sure that all of our personnel in Title I schools are targeted and that we have an opportunity to address them at those schools if necessary?
Commissioner Trevelyan, we have not decided to use the mobile teams that way. One of the things that we have done thus far is we have a closed location that we have allowed teachers, school staff to go to those. And those are basically where staff are reaching out to them and actually scheduling an appointment. So even though they're going kind of the mainstream way at the site on Saturday, there are other days of the week, 5 other days during the week where that staff are able to go. That process has worked very well. Our staff have been able to target those efforts with them, and we can continue to do that. And so we can definitely, I'll mention to staff that you want to make sure that we are adding special efforts for Title I schools.
Well, and I appreciate that. My last comment is, when I looked at the 8-week approach versus the 12-week approach, it seemed to me that the 12-week approach is reliant on the existing pharmacy and grocery store structure, which is not as available and apparent in the Eastern Crescent. And I just want to make sure that it doesn't bother me that we have a public-private rollout, but I think that we have to take specific steps to address the lack of an infrastructure in the Eastern Crescent and the institutions which can be worked through to make sure that we are doing some of the things that could happen in an HEB in the west part of town and can't happen in a grocery setting or a pharmacy setting on the east part of town.
Well, and Commissioner Hall, let me respond to that by saying the benefit of the public-private path is that as the pharmacies start to provide vaccine, as the healthcare clinics and other vaccine providers ramp up their efforts, that frees up city and county resources to only focus on those communities in needs. It really allows us to shift from a population-based approach for vaccination to our traditional clients, which are those who don't have access to other means. It allows us to have smaller vaccination efforts, which are closer to people's homes or churches or businesses, so that we can do a more effective job at reaching that group of people.
I appreciate that. I just always like to see the operational plan as we change strategies and as we change tactics. I just want to make sure that there's an operational plan in place so that we can explain to the community exactly what's changing and how that's going to impact their ability to gain access. So thank you.
I'm sorry, Commissioner Howard.
Thank you, Judge. I don't really have any questions. I think that everything Commissioner Trevelyan said rings true to me. We just want to make sure that we have access all across the county from the east to the west. So thank you for all the work. Thank you.
All right, and I kind of already went earlier, so I'll just go ahead and pass it on over to you, Mayor, for y'all's questions.
All right, thank you. We'll work through our council this time from 10, working down to 1, give people a chance to do that. Councilmember Alter, do you have any questions?
Yes, good morning. I can't tell you how exciting and refreshing it is to actually be talking about our ability to ramp up to herd immunity and to have that target, within striking distance and have vaccine flow and really be able to talk about that. So very excited that we're able to have some of that conversation this morning. I had one point of clarification and then a question. So the point of clarification is trying to understand how the scenarios that Director Hayden-Howard put forward and the information about CODA go together, because I'm not sure that those are the same numbers and whether the APH numbers include CODA, and if we combine them, if it would be faster. So if someone can explain how those work together in terms of how we're thinking about how many weeks. Director Hayden-Howard was talking about Travis County alone, and the judge was talking about counties. So the numbers are not the same, but in terms of for what would happen for Travis, if you could talk about that. And then my second question is, with respect to the call-in number, which I guess is the 972-5560 number, we're hearing that number is not being answered. And I don't know if it's certain people are calling and they got into some purgatory and it didn't get answered, they just need to hang up and call back, or if you could tell us what's going on with that number. I believe that's the number people call if they are not able to do stuff online and they don't go through 311. But we're hearing some concerns about that line and what's happening there.
The information that I shared about herd immunity is based upon what Austin Public Health would do and the scenario, including the private community. It does not include what is happening at CODA. So we would have to get with the judge and have a conversation about what that data would look like. I will check with staff about the 972 call center number. It should be working. So it may just be, technical difficulties, et cetera. But we've added some additional staff. We've shifted off the nurses because we need them to be providing vaccines. And so I will follow up with the team and get an understanding of what's happening with that line.
And if my team can be helpful at all with sharing the info we have, let us know. But the concern is we're hearing people who are staying on for hours and never getting an answer, and just need to know if people are in fact answering and they just need to hang up and try again because they got somehow into some weird place, or if they're not, if it's taking them really long time to answer calls. We just need to know that so people know what to expect. Thank you.
Councilmember Alter, I'll just add on to Director Hayden-Howard's response. There are lots of different versions of the math depending on where the vaccine goes. The 24,000 that was mentioned in the presentation is 12,000 from APH, 12,000 from Dell Medical School. Those are the two hub providers. There was actually about 24,000 more vaccines distributed throughout the Travis County community. So really, even if we have a few players, APH, Dell Medical School, the CODA effort, HEB, and some of the large pharmacy chains, really the timeline starts to compress significantly if we can get the vaccine. We introduced that there are 350 other vaccine providers in the community, and the numbers that they need to provide on a weekly basis are really very small to really get us vaccinated by the end of May. I think it's important for us, again, that we push this effort to ensure that we can get everybody vaccinated, every adult vaccinated by the end of May, so that we can start to decrease that risk of the variants emerging and potentially new variants emerging. That gives us the summer to focus on our children, and hopefully we'll see a vaccine available for them over the summer, so that by the start of the school year, we can have a normal or near normal school session for the first time in a while.
Okay, thank you. Councilmember Tovo, do you have a question?
Yeah, I do. That too is an exciting prospect of having a near normal school experience for all of the many educators and parents and students, including those in our house. I had a couple quick questions, and one relates to that. Do you have any sense, Dr. Escott or Dr. Hayden-Howard, of what percentage of educators here in Travis County have been vaccinated at this point? I know at one point you were able to estimate how many weeks at the current rate of vaccination it would take to vaccinate all those who had registered in the APH site who were currently eligible. That was, a month or so ago. But I just wondered if you had any idea, if you could give us any sense of where we are with regard to the educators. And then my second quick question is really one for the judge, I think for Judge Brown, and that is if you have any on how many of those being who have been vaccinated out at CODA are Travis County residents versus residents of other counties.
Councilmember Tovo, what we typically do when we look at the school footprint, we don't only count educators, we look at all of the staff in the schools. So thus far, we provided 5,500 vaccines to school staff. And so that is your teachers, that is your cafeteria worker, bus drivers, et cetera. And so we've sent out a survey, and we are right now, based upon what we've received, we know that there is at least 22,000 folks that have been accounted for in that survey. That is not the full survey. So I just want to kind of put that out there. That's based upon what we've received. In our system, there's about 10,000 folks that have signed up that say they work in an education capacity. And so those are the kind of the universal numbers that we have. Our staff will, continue to pull in information about the full number, but right now we are aware of 22,000.
Dr. Hayden-Howard, just to clarify, that is, and yes, thank you. And I wanted really that number, that broader number for all who are kind of involved in the educational mission, whether they're teaching in the classroom or on the custodial staff. So I just want to be sure I understood your answer. So 5,000 have been vaccinated within Travis County, of Travis County,
That
fall
is,
into that category.
that's Austin Public Health. So that does not pick up, what CODA efforts have done. So they would have to share that number with you.
And you're aware of 22,000 others in the APH system.
No, the 22,000 were based upon a survey that staff sent out to the school districts, charter, public, private, and that is still not a full response. In the public health system, there's 10,000 folks that are registered.
Thank you. And does that also include childcare providers and those with childcare?
No. Right now, we've provided 2,168 folks that work in the childcare arena. Staff have not shared with me kind of the survey of that number.
Okay, very good. Thank you so much. And then I guess Dr. Brown, Judge Brown, if you would pick up on the CODA question with regard to Travis County residents, but also if you have a count for how many of those associated with education have received vaccinations out at CODA.
Yeah, thanks. So my understanding is we've done probably about 100 childcare providers. This past weekend, we did 1,000 AISD employees, so teachers and staff. We did 420 or so from Del Valle ISD this past weekend, again, teachers and staff. And then in previous weeks, we've done the over 65 population from AISD, Del Valle ISD, Pflugerville ISD, and Manor ISD. And I think of the numbers that have come through either CODA or the clinic that we first did with Constable George Morales, I think that total would be somewhere between 500 and 1,000. The numbers of 65 and over were not super high for those the three Eastern Crescent ISDs. And so I would guess the total number of educators, of teachers and staff from ISDs and childcare workers that we've done is somewhere between 2,500 and 3,000. And I can get a more accurate number later today on that. And then I think this weekend, our hope is to dedicate all 5,000 that we're giving out on Saturday to ISD employees and workers. And then as far as what is being done, Travis versus others, we had been looking at it mainly in terms of community care patients. And I know that there are obviously community care patients because of, many reasons. People might work here and live in the surrounding counties for a variety of reasons. So I don't have an exact count of what the breakdown has been between Travis County and the other three. I do know that we are in more or less start doing it now as on a per capita basis based on the vaccines we get in. So, we've got 1.3 million people in Travis County, 88,000, I believe, in Bastrop, 43,000 in Caldwell, 230,000 in Hayes. So it will more or less track that in terms of the populations that we're hitting going forward. And I guess further, on the very first, the 3,000 that we did that first week, we divided it up into 6. And so
Got it.
Or five partners, I guess. So each county got an equal amount, and then community care got an equal amount. And Travis County, in effect, gave its amount to community care. Each of the other counties gave half of their amount to community care. So
thank you.
I can try and break those down a little more exactly for you later today. But the general sense is that I think that first week we probably did more in the surrounding counties than their population would dictate. But now we're moving to more based on populations where we're doing a lot more out of Travis County.
Thank you very much. Thank you both for all that information. That's very, very helpful.
Commissioner Tova, just to give you a little bit of data, the state estimates 32,884 individuals in the school staff or child care staff. 32,884.
You're muted, Kathy.
My apologies. So that number, Dr. Escott, is for school plus childcare in the Travis County area?
Yes.
Super. Thank you very much.
You bet.
Okay, thank you. Councilmember Ellis.
Thank you, Mayor. I've got a question for Dr. Escott for clarification. It seems that some people, once they're getting their first round of a vaccine, are under the assumption that they no longer should wear their mask, they can't spread it, it's okay to go back to normal. Can you provide a little more insight into what the expectations of being able to spread or get infected are among individuals who are in the process of getting vaccinated?
Yeah, so immediately after your first vaccine, you have little to no protection at all. As time goes on, the protection continues to improve. And really, the protection is at its fullest 2 weeks after the last dose of the vaccine. So for the Johnson & Johnson, that's the first dose. For the others, it's after the second dose. Yesterday, the CDC shared some new advice for individuals who've been vaccinated, which decreases the restrictions for individuals who are fully vaccinated to be around one another. Again, it's still focused on family members not being out in the public without a mask on. Again, the best advice right now is wear a mask wherever you go if you're leaving your house. Again, we have to be aware of the variants and decreasing efficacy of the vaccine associated with variants. That's the known variants as well as variants that could emerge at any time, which may further evade the vaccine. So again, the advice across the board, if you're out in public, is wear a mask.
Thank you. And I think I saw in that graphic that if there's anyone in your close range that is unvaccinated, that people should behave according to protecting the least vaccinated person that may still be in your family household. And then I know that Austin Public Health had shared a graphic yesterday that kind of answered questions about if you are 28 days from your first vaccine or 42 days and when you should expect your next appointment to be scheduled. Can Dr. Hayden-Howard or Director Hayden-Howard briefly discuss that? Because I know I got a question on social media that was about, if I hit 28 days, do I just show up? Do I wait till 42? How does that work? And I do appreciate public health staff manning the social media accounts and trying to help answer as many questions as possible. But can you talk a little bit about that timeline?
Yes, the graphic that we shared on social media is just basically a chart that it's a flow chart. And so essentially what it's just saying to folks is that if, you've had the vaccine and it's been, 28 days, our goal is that we are going to proactively schedule those appointments. And so you should hear from our office within 5 days. The other point is that we give you the card. And so the card will be very close to the date of when you would come in based upon, the date of clinical operations. And so they should be receiving an email with an appointment. If they've been folks that have gone through the equity line, they will receive a phone call from that team. We've also sent out text messages as well. One of the other options that we have put in place is that there is a form that folks can fill out if they've not heard from us. And so going online and filling out that form and submitting that to us. That way it allows us to kind of true up. What we are finding is that unfortunately folks have created several accounts. We have some folks that have created 4 and 5 accounts. And so each of those accounts are tied to an email address, which potentially they may not be checking. When I was on the site last night, the staff were trying to assist a person to get an appointment. And they just basically said, oh, I used my other account and I got the appointment through that. And so we really don't want people to create all of these accounts, because what ends up happening is that staff have to go through every one of those accounts to see, where your information is actually flowing. The other thing that we've also noticed with accounts is that some folks end up not being eligible because they put in an incorrect date of birth, and it shows them as being a 1-year-old. And so it's those type of things we're concerned about. Cookies, we wanted people to make sure you turn those off. And so it's those types of things that, our folks are just kind of reminding folks, and then having information that shows when you're starting to log on. And so at the 42-day mark, in case someone is missed and you're like, oh, I'm looking at my card, they haven't emailed me, they haven't called me, it's been 42 days, they can go to a site with that card and we will provide the vaccine to them. So it gives us a way just to kind of how we can catch everyone, just in case someone is overlooked.
Thank you. That's really helpful. And I appreciate all the hard work that you've put into it and for your staffs. I know it's been a long haul coming up on 1 year, but I really appreciate it.
Thank you. I think Councilmember Kelly said she doesn't have any questions
I think
further today. Councilmember Poole.
Dr. Escott, I heard and read yesterday a really exciting report from the Hill about the Centers for Disease Control making some statements about people who had received both their vaccines and their ability to congregate with folks in their homes and so forth. I was not able to jump onto this call right at 9 o'clock. I think I got in about 10 after 9, so I may have missed any discussion of that. But if you could please expand on it in case it hadn't yet come up. It's like that light that we all know is at the end of the tunnel is literally getting closer.
Yes, Councilmember, I'm happy to discuss that. We'll be sending out some infographics, I think probably today or tomorrow, from APH to help explain that. Basically, individuals who are fully vaccinated more than 2 weeks after their final shot, if everybody in the group is vaccinated, they can congregate without distancing and masking. Again, this is designed to allow family members to be together, one household plus another household, if everybody's vaccinated. There's also some allowances if everybody's vaccinated except for low-risk individuals. It also allows for some commingling. But as was said before, the default should be to the least protected person. So if you have one person who is at higher risk for severe disease, then everybody should mask even if they've been vaccinated. Again, we can expect that as we roll through the spring, we're going to see changes in the guidance and how to manage individuals who are fully vaccinated. So we can expect to see some further improvements in that guidance as we go forward. We have more data now that suggests that while individuals who've been vaccinated can transmit disease, it's really unlikely that will happen because the viral load is so much lower in vaccinated folks who get COVID-19. It makes it very, very difficult for them to then transmit disease to other people. So we should have something out in the next couple of days on that from Austin Public Health.
And so that includes the 2 weeks after the full vaccination. It includes still wearing masks and social distancing in public. And I think if I'm going to quote Rochelle Walensky, the CDC director, I guess she talked to reporters yesterday, and she said, if you and a friend or you and a family member are both vaccinated, you can have dinner together without wearing masks or without distancing. And in addition, vaccinated people can visit with someone in a single household who is not vaccinated without protections as long as you have had your double dose and have sat out the 2 weeks, right, for Pfizer and Moderna, and I guess also for Johnson & Johnson. I just think that should be, that along with the continuing cautions, of course, really should be our headline. This is the really, really good news we've all been hoping for, and I think it should also underline and emphasize the importance of continuing to wear our masks and keeping our distance socially so that we can force it down even further, like your graphs were showing, and also so that we can have that kind of joyous reunion that I think we all are going to have sooner rather than later. But if we let down our guard, that sooner will be later. And dang, I think we're all desperate for it to happen as soon as possible. So continuing with the masks.
Yes, that's the name of the game right now. And again, when we look at public policy that's likely to evolve over the next several months, that policy should take a little bit of additional risk at a time. You take some time to assess the impact of that little bit of risk increase, and if you did okay, you take a little more risk. These dramatic shifts that we all want to do, we all want to be there, we want to take risk and return to normal, those are going to come back to bite us as they have every other time throughout the past year. So we all have to be comfortable with incrementalizing that risk so that we can keep one another safe and avoid that third surge.
Thank you. Councilmember Kitchen.
Yes, I just want to thank Director Hayden-Howard and Dr. Escott and the whole team that's working on this. I believe there's been significant progress in reaching out to vulnerable populations and seniors. And I know that we're all feeling some light at the end of the tunnel as we get more vaccines into our community. And I also want to reiterate the caution, Dr. Escott, that we should wear masks. And thank you, Councilmember Poole, for that. So my question, I have a quick question. Well, I have two questions, so I'm just going to ask one of them now, and if we go through again, I'll ask that. I want to shift a little bit as we look forward to schools opening up and the potential for others to open up in the future. I want to ask a question related to infrastructure, I guess, might be the way to talk about it. And what I'm thinking about is ventilation systems and systems to help filter or screen in buildings. And I know that that's not something that's been top of mind at the moment because of our efforts to reduce that risk. But as we are in buildings more, as kids go back to school, that sort of thing, Dr. Escott, can you help me understand the extent to which there's been any thinking or progress around how we might think about our public buildings and how we might think about the ventilation systems and filters that can be put in place?
Councilmember, thank you for bringing this up, and it is an important factor as we consider the end of COVID-19 and protections for future airborne pathogens, even things as simple as flu and tuberculosis. These enhanced ventilation systems can really help to decrease the ability to transmit those, particularly in large closed spaces. I'm happy to say that, we've been discussing this particular issue with the Austin Convention Center related to the city facilities, and they've made some significant changes associated with that to help better protect visitors to Austin as they use our convention center space. I think this is something that we do need to look forward to in the coming year to 2 years to help solidify that infrastructure to better prepare us for future outbreaks or even a bad seasonal flu. Because we know that ventilation systems usually aren't at the top of the list of budget needs or desires, particularly as it pertains to our schools and our Title I schools. It is something that we need to look at and plan for in strengthening our infrastructure. There are many other issues, but that certainly is one of those that we can make significant improvements on.
One follow-up question. Do you know if there's any efforts at a federal level to provide assistance to schools, for example, to put ventilation systems in place, or do you know if it's even being discussed at this point?
I haven't read through the full text of the COVID relief bill. I understand that there was a significant amount of money earmarked for schools, but I'm not sure if that if infrastructure-related ventilation is among the items that those funds can be utilized for.
Thank you very much. I think this is something we need to have begin to have some more conversation about and plan for. So thank you for that response.
Councilmember Kassar.
My question is about.
Go ahead. You're fine.
You can hear me now. My question is about making our goals explicit if we've reached having those goals. I've heard in this presentation what sounds like really powerful and positive news that we want to try to get to that herd immunity between the next 8 to 12 weeks, or Dr. Escott, I think you said, that basically equates to the end of May. Is that based on the supply that it seems like we might get from the federal government and from the state, is that currently our goal? And I understand that you're going to there's all sorts of caveats about things we can't control, but now that you've sort of said it, I want to understand and know whether that's what we're trying to get to.
Councilor, I think that is what we're trying to get to. You have identified the unknown, and that is, will the vaccine supply be able to get us there? I don't know the answer to that. We certainly are seeing increased indications from the federal government that the number of vaccines available will continue to increase through April and into May. So I think it's very likely that we will have enough to do that. The question is, how soon will that increase start to be realized? It could potentially, if it's a slow increase with a much larger increase as we enter into May, it may push the timeline out beyond the end of May. But that's where you have to have some flexibility. That's where the public-private partnership helps us to distribute the load amongst 350 providers rather than just a few. So really small increases in the output from those 350 providers can start to make up a lot of the difference very quickly if that vaccine load is weighted towards May.
And so right now, the limiter on getting to that goal is supply. And we can keep on advocating and hoping for the supply to reach the level so that we can reach the goal of in the next 8 to 12 weeks, getting to herd immunity. And then as Director Hayden-Howard said, if we get sufficient supply, but we see issues with demand, then we need to do education and outreach. But thankfully in Travis County, it seems like a lot of people really want to get the vaccine. So I hope our issue, once we have supply, is not demand, but we can do our best to address that. What I want to state clearly here is that what we can't have is be the limiting factor be our distribution capacity. That once we get enough supply, we absolutely need to make sure that every single vaccine gets into an arm based on us or the private partners being able to get it into arms. Director Hayden-Howard, you kind of presented two scenarios for distributing it. Is it our sense that if there is sufficient supply and then there's sufficient demand, that we will have the distribution capacity to make sure that we actually can get that many vaccines out between here and the end of May?
The preferred route is the public-private partnership that has served us well in the past. It allows so many more locations. We definitely, keep in mind the equity needs and the needs of the Eastern Crescent. Allows Austin Public Health and potential partners that we would contract with to focus our efforts in zip codes where we've seen a high increase of positivity.
But if that many basically what you're showing us though is if that many if a lot of vaccines do come to us though, as opposed to as many going to the private partners, that it might cost us more money, but we can hire the staff and ramp up the capacity to get those vaccines out? Is that what you were showing us in the first? You showed us two scenarios.
We showed you two scenarios, but the reality is the second scenario is what will probably happen. The first scenario is not as likely because what the state has done this time with this pandemic is that they got all of those providers signed up and have them approved. In the past with H1N1, they did it on the back end. They worked with the local health departments, and the local health departments, were able to kind of start the process. But then from there, the vaccine went out to the private partners. And so what would typically happen is that the private sector will definitely stand up. They already have their facilities operating. They are already providing some vaccines right now. They don't have it at the level that they can provide it, but they are ready to provide the vaccines. And so that one is more likely because of the fact that also those contracts, those federal contracts are in place and they are already receiving vaccines.
Right, but just to be really clear, we aren't choosing scenario 1 or scenario 2. It sounds like the state and federal government choose scenario 1 or scenario 2 for us, and then we execute based either your first slide or your second slide based on what they say. Is that right?
That's correct.
And what you're showing us is it's more likely that they're going to pick number 2 because that's what they've been doing. But if they pick number 1, we are going to do it and get shots in arms. And if they pick number 2, it's going to work. But what you're showing us is either way, if the supply is there, we aren't going to let distribution capacity limit vaccines. We're going to make sure that we get all the vaccines out in 8 to 12 weeks if they deliver enough. And these are the two different ways you do it based on what they pick. Is that accurate?
That is accurate.
Okay. I think that's really important for us to be able to communicate and commit to that, once there's enough vaccine and if people want it, we're not going to be the ones slowing down in any way it getting out. We've got a plan to get it out. And if any of that becomes hard or you need something from us or from the community to get that done, then of course you guys come and let us know, because distribution capacity shouldn't be the limiting factor here. So thank you all.
Thank you. Councilor Renteria, do you have any questions?
Yes. I want to know if, VA is now administering shots to all their veterans, and they just recently lowered the age to 65. Do you get that information, how many people they have administered shots to?
It goes into the Texas Department of State Health Services. It does not come to Austin Public Health. And keep in mind, it's veterans in general. So that's not going to be just Travis County. It could be, across the MSA.
Yeah, I know, because my wife got her shot there at VA. And my son got his shot because he works for the school district. And so also his wife there at F1 got hers Saturday. So I'm really thankful for that. I was very alarmed because I was there at a fast food shop getting a sandwich, and saw some, after the governor announced that they were not going to mandate masks anymore. And these customers came in without masks, and the lady was trying to tell them that we don't serve, because she's diabetic and she didn't want to serve them, but they got really hostile. And I'm afraid that this is what's going to happen here. Yeah, and that people are going to be, being very disrespectful for businesses that are having their mask-only customers, and they are wanting to challenge, these businesses and walk in. And we saw that happening early on in April and May of last year, where there were fights out there in the store. And I just hope that people realize that these people, some have, existing, medical, and they're going to be out there being really hostile to these people that have no, they just want to earn a living and work out there. So I really want to reach out to the grocery stores that are mandating masks so that, they can keep their workers safe and their customers safe at the same time. So that I just want to give a shout out to those people. And to the ones that are trying to challenge this, I hope that they have a little bit more respect and act their age instead of going in there and picking a fight.
Thank you.
Councilor, let me respond to that, and I want to make it very clear to our community. In the city of Austin and Travis County, businesses are required to require masks. If an individual enters a business that requires a mask and is not wearing a mask, and they are asked to leave and they do not, they're trespassing. That's a crime. They can be arrested for that. They can't be arrested for not wearing a mask. They can be arrested for trespassing. If that trespassing involves violence or threats, it's going to increase the level of the crime that's involved. Again, people can have their own personal views about masking. They can't do that when they enter in a business that requires masking. They give up that right. If they don't want to go to that place of business, they don't have to. But if they go in that place of business, they have to have a mask on.
Thank you for saying that, because we're really going to need the help, and to inform all our small businesses and grocery stores that that they do have the support of the city and the county. So I want to thank you for that.
Thank you. Councilmember Fuentes.
Thank you. Good morning. So my line of questioning, really, I was looking at today's hearing and looking at the material from the lens of, we have 11 weeks until the end of May. And as stated earlier, President Biden has committed to having enough vaccines within the next 11 weeks. And that, in seeing today's presentation, has been super helpful as a starting point for us to have a conversation of what does our plan look like to meet the need once we have this supply. And I appreciate my member Kassar's line of questioning, because I really want to build off of what the conversation you all are having around the two scenarios that were presented during today's presentation. A few months ago, some of my colleagues and I drafted a letter to draw attention to the disparities we were seeing in vaccines access. So in looking at strategy number 2, which Director Hayden-Howard, you've mentioned that is kind of perhaps the preferred option of what we could do. I'm looking at this slide from, okay, well, with equity in mind, what does this mean? And so my first line of questioning, and I want to ask about mobile vaccines, but I also want to talk about the registration process. And then also talk a little bit about employer outreach, because we received some data that that's another area that we really need to hone in on, and making sure we have safe working environments and education around employers and how they can help facilitate vaccinating employees. So with looking at strategy number 2, I see that you have 100 doses outlined, or I guess kind of earmarked for mobile sites. And could you talk a little bit more about the mobile vaccine outreach? Because I think that is a significant tool for us to truly meet our community in need. We all know the barriers with online registration, getting folks through the process. And I'm glad to hear that there's a form that folks can fill out if they haven't heard back from AHA. But again, that's requiring people to go back online to fill out that form. I really like the concept of doing these mobile pop-up sites for vaccines, where we have a vaccine mobile clinic that goes into hard-hit areas where we don't have a pre-registration at all, where folks can walk up and get vaccinated. I think that would do wonders for our community. So I want to make sure that our mobile outreach strategy is robust and well thought out, especially knowing that we're anticipating this supply within the next 11 weeks. So with 100 doses earmarked for that mobile tool or the mobile strategy, can you talk us through a little bit more about what that looks like? Like, for example, how many mobile sites are we thinking about? Have you already identified areas where these mobile sites would go? Has APH engaged our fire department and sought a partnership with AFD on really utilizing fire stations, which were already well suited in our neighborhoods? Have they been engaged to perhaps help with some homebound vaccinations? So to help our seniors who aren't able to get out of the house. And so I guess I'm just trying to get a sense of what are those conversations that you all are engaging in around mobile outreach. And then also if you could touch on the operating hours, because just want to make sure that we're keeping in mind with our working families, taking an hour out of their day to go get vaccinated might be challenging, which is why we also have to get that employer buy-in as well. So that's kind of my first round of questionings.
Okay, when we look at the mobile efforts, the mobile efforts will be using non-traditional settings. So what we've done thus far is we've been working with the housing authority, and typically what the housing authority has done is they will typically collect the names of the individuals that need to be provided the vaccines. And so each of these partners, like Housing Authority, Foundation Communities, they assist us with determining where we can be. They assist us with a list of folks that they're going to refer to us. And then our team will work with them to schedule the folks to come in. And so that is what we've done with the Housing Authority. And we'll, continue to do a little bit more of that this week, as well as Foundation Communities. And so what ends up happening is that everyone has to be in the system. And so what happens on the back end is that our folks are here on campus doing data entry. And so they're entering all of that information in the system, which allows us to run reports and use the dashboard. And so with the mobile efforts, they are a little bit more flexible because we're going to a site, working with a partner on a captive audience. And we will definitely continue to do those efforts. One of the things that we know is definitely going to help us from an equity perspective is to continue to do those efforts. We've identified several locations, had conversations with several partners, looking at faith-based locations as well to be able to provide those services. One of the things we've talked about, with some of our partners, because they have folks that may be willing to either help with their congregation to train them, to teach their folks how to set up those accounts. And so our teams have been hosting some events. We're going to do another one on 24th, 25th of this month. It's in English and in Spanish, working with the parent support specialists at AISD, for example, because wanting to be able to have them to work with populations that are saying, if you train me and teach me how to do it, I will be willing to set up my own account. So it's a hybrid type approach that we are having with Train the Trainers in our communities and with partners that are willing to do that. From the fire perspective, early on, we did have conversations with Chief Baker. As you all are aware, the fire staff have been a tremendous help to us. They are at our existing pods, helping us providing vaccines, as well as they've been part of the incident command structure and have also helped us, from kind of a drawing perspective, putting vaccines in needles. And so we've used them that way. The fire part of it to sign up is voluntary. And so, so we are working with the fire department because they're going to bring back on some retirees that have retired to be able to kind of funnel them into our operations. The other thing is we're going to be working with Meals on Wheels and starting with them roughly probably about the 22nd of the month to be able to kind of go from home to home with folks as they are delivering meals. And so we're definitely, kind of looking at all of our operations and, how we would be able to continue with our mobile efforts, but also, keeping in mind that some of the smaller locations that, for example, are in Dove Springs or that may be in the Rumberg community, those locations have worked well. And so having a combination of different types of footprints. And then we are also looking at hours, because in our conversations with some of the faith-based folks, they said, hey, we're willing to do this on Sunday after church. And then we've had some other partners to say, Saturday, Sunday are great days for us to sign up folks and have them to come through. The other area is that, making sure to work with our partners to be able to get the information out to employers, making sure that they have the information that they need from a safety perspective. And we've continued to do that this entire time. We will continue to do that as things are reopening. For example, our environmental health staff have already started having conversations with the restaurant owners, but they're also starting to talk with people as folks may look to open up, pools in the area, but making sure that we are having those conversations, or our partner that has contracted with the department is doing so. So we definitely have a significant amount of work that is going on in the department.
Thank you. And just so I'm clear, so at this point, APH will not be operating its own standalone mobile clinic. It will be all done through, or right now the plan is for it to be done through a partner organization, for example, Meals on Wheels, like the one you just listed.
Yeah, so it's different operations. So the example with the Meals on Wheels is that's a part of our mobile team. So they would be working with Meals on Wheels to identify locations where they would go to provide the vaccine, for example. So that's an example. Or the housing authority, well, they will say, okay, partner with us. We will provide the community room at our site. We will organize all of the folks who would need the vaccine, et cetera. And right now we're working with seniors and people that are disabled. For example, with churches, for example, most of them are getting less in their congregation of folks that are 65 years of age and older or meet the 1B criteria. And so all of the partners, it's definitely a partnership where the partner is responsible for certain aspects of the mobile operations, and then Austin Public Health is respond for bringing the vaccine, the staffing, et cetera, indoor and outside of the facility, for example.
So just looking at the numbers from working at HACA and Foundation Communities, I mean, that was only like 3% of APH's total weekly allocation. And so I guess then I'm just trying to think, like, are we reaching, because at this point, either you are a resident at a HACA property or Foundation Community, or you're on a Meals on Wheels list, or you happen to be a parishioner of one of the churches that is partnering with APH. Other than that, the outreach that they're getting from APH is perhaps no, they're not getting a phone call because that's based on a referral list. So then at that point, if I'm an Austinite that's not affiliated with any of those entities, then it's up to me to get registered online or to call the number.
Well, we have 8 nonprofits that are on contract to, that are doing the outreach education part of it. As you also know, the department has several nonprofit partners that we fund that have said these are some of the efforts that they are willing to do. If there is a person that does not fit into any of those scenarios, we are encouraging them, if they know how to be on a computer, know how to operate the sign up, we're encouraging them to go to the system to sign up to enroll. And then that way, we typically, we will not, be able to miss anyone, because most people will be going through the portal, or they would be working through a partner. In the instance that it is a senior citizen that is not doing any of those programs, our staff will be creating a flyer for Homebound. We've received some referrals from that. Our folks are collecting those names. And so our staff will be doing home visits for folks that say, me and my wife are disabled and homebound. We're not working with any of those organizations. And so basically our staff will be able to go into their homes to provide those vaccines. So folks are going to fit into one of those categories.
So is there a reason why APH is not considering doing a mobile vaccine clinic on its own?
Are you saying to be in a van going around from place to place providing the vaccines? We actually had a conversation with a company last week that did provide us a proposal. And so the purchasing team are looking at that. So that is something that we have on the table that we are considering.
Okay. And then I guess going back to the call center, you mentioned earlier that we had to pull operators from the call center, if I'm right, to help with actual facilitation of vaccines. So how many operators do we have right now answering the call number, and how many of those are bilingual?
So we have within Austin Public Health, and we're still working with the county. The county has their 20 staff that are providing outbound calls. We have our Austin Public Health staff that are answering the calls as well. So between the two of them, it's a footprint of about 80 people. And then about 15 of them are bilingual.
Okay, and my last question, just wanted to get a sense, it just seems like there's so many moving pieces with, different providers and even if we go to strategy 2 with APH working in partnership with a private provider, how is all of that being coordinated between, I'm just trying to get a sense, is there a coordination of like you and others who get together for a meeting and say, okay, the Austin area has this amount of supplies. We're going to ensure that we get all of our educator and childcare staff vaccinated this week with that supply, or even like a coordination on asking for more, an increase from the state health department. I'm just curious about that type of coordination amongst all of the different providers.
We have a vaccine coalition that meets. It's a regional coalition with members from Hayes, Bastrop, Williamson, and Travis County. Within that coalition, there's also a subset of that group that are providers. It is not every provider that is been approved by state health services. But what we've been able to do is to develop a plan that we've put out to the public. And so basically, we will provide guidance of what we're going to do on the Austin Public Health side and encourage them, for example, like the school Saturdays, for example, definitely want to encourage them to be present and to do that initiative. And so having those conversations with them on a regular basis, sometimes it's in a larger group and sometimes it's in the smaller group.
Gotcha. Thank you.
Thank you. Mayor Pro Tem?
Thank you, Mayor. I have to echo the sentiment of the first colleague of mine who spoke. Councilmember Alter seemed genuinely enthusiastic, and that's how I feel. This feels like the first good news in a very long time, and that tells you a lot about what kind of the rapid succession of bad news that we've been receiving. If this, which even in and of itself is not great news, but it's the best news in a long time. So I feel very much like this was an optimistic presentation, and I appreciate all the hard work that's gone into all the points of consideration. Literally half of the questions that I otherwise would have asked Director Hayden-Howard, you just boom, 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 and then Dr. Escott, is answering most of those questions. I really only have a few left, but just want to say thank you to all the folks who've been pouring so much hard work into getting us to this place where it does finally feel like we can breathe again. So a couple of my questions had to do with, I guess, populations of folks that I didn't hear us speak specifically to. You have to forgive me if I walked away because of the cedar for a second. Did we speak to incarcerated people and what our vaccine strategy looks like there? And or, other, I can't think of another example, but other examples of close quartered living accommodations?
Yes, we've worked with Travis County. We have provided them some vaccines to provide to their inmates as well, and we will continue to work with them. One of the other areas is that we've had conversations with some of the smaller locations where they are board and care facilities. Our staff have met with them throughout this process. One, to ensure that from a safety perspective that they adhere to safety. And so one of the things that we're rolling that into our operations so we can also provide those vaccines, because what we are finding is that, some of the locations have people, that suffer from severe disabilities. And so it's really not going to be helpful from them to leave that facility to go into one of our facilities, even though they're ADA compliant. It would be easier for us to work with our mobile team on those efforts.
Thank you. I appreciate that. I also wondered how we're addressing some of the multifamily complexes that aren't a part of the HACA inventory. We have some that are income restricted, but they wouldn't be on their rolls. And so I just want to make sure we're not missing any. Do we have a system for capturing those?
So what we're doing with this round, because of the real push out from the governor's office is wanting 65 years of age and older, and so that's why we focused initially on HAS that are primarily seniors and people with disabilities. With the second phase, when we start to look at when it's opened up broader. And you've probably heard Dr. Escott refer to it as 1C. The majority of folks may fit into that category. We know that there's mixed use audience in those as well. And our hope is if they do fit into the current criteria 1A, 1B, that they would reach out to us if they're not associated with one of the nonprofit organizations.
I'm sorry, I just want to get some clarity. When you say they reach out to us, do you mean the people who operate the facility or property management or the individual parties?
The individuals.
All right. And then my last question is, I really appreciate the effort that Travis County did out at CODA. I just can't help but think how far CODA is for, a lot of the folks who otherwise would love to have access to that resource. I just wonder if there are other considerations about considerably further north, sort of Samsung area or central mass distribution location in addition to CODA.
Well, the department is looking at Expo. As you may recall, in November, we did an exercise there. And so our goal is to work with the county to provide vaccines at that location.
Yeah, and I can jump in a little bit on that. Community care also is simultaneously getting vaccines out through their own patient network and other places. I believe they have a site in Central East Austin, and I believe also in Pflugerville. But to your point, yeah, I think what my personal goal is to try to make sure that we have full capacity going at Circuit of the Americas, because I think just the mass numbers of people that we have to get vaccinated. I think our first priority should be getting that up and running at full tilt. APH, same thing with their sites. And I do, the people who have been coming through the CODA, based on the community care outreach we've been doing, I think have been a group of the population that I think you and I would both agree are people that we should target first. And I've been really impressed with the work that community care has done to reach out to those communities to get them in there. But yeah, I agree. I think we need to work on getting CODA up and running, Expo Center up and running, also other places around the county. Because like Councilmember Kassar pointed out, I think our duty is to make sure that we have full capacity in the entire county, east, west, north, and south, so that when we get these mass quantities of vaccines, we're making them available to people no matter where they live, no matter what their income is, no matter what their ability is to drive somewhere. And so I think that will include mobile clinics. I think that will include smaller clinics in different neighborhoods around the county, but would love to work with you, Mayor Pro Tem, on planning those locations.
That'd be great. Thank you. I appreciate it. Thanks, everybody.
Thank you. I again want to thank Dr. Escott and Director Hayden and your staff's work. Thank the county and everybody, community care, Seed Ascension, for helping with the sites. It's good to see the numbers that are coming in, and the news has been really optimistic this week and with the CDC. So I agree with everybody looking at this light at the end of the tunnel. I remain real concerned, as Dr. Escott, you expressed, that it could all be, it's precariously balanced. We got to this place because of the behaviors that everybody adopted. And we are so close now to being able to run this course, and how important it is for us to be able to maintain that. And I sure hope we're doing everything that we can in order to be able to do that. I have been contacted by a lot of businesses that want to be able to support that and want to be able to require their employees to and customers and everyone to mask when they come in. But are hoping for some order or sign or unambiguous statement from the leadership in order to be able to really give them something to be able to rely on. I think that was part of the initial confusion or ambiguity that resulted when the governor announced his next stage with some of the grocery stores that were trying to figure out what to do. So I want to know exactly where we stand with respect to the orders that exist now. As mayor, I've entered orders that require masking, require businesses to require masking, and that order still reads the same way. The governor's obviously taken the position that his order trumps a mayor's or a county judge's order in that regard, because the legal arguments that are currently before the Third Court of Appeals right now relative to what we did for New Year's Eve. But so as to not politicize this, while the order reads that way, we're not going to enforce the mayor's order, my order, and let the Third Court of Appeals wrestle with that legal question. But separate and apart from that, Dr. Escott, as the health authority, has been very consistent about his rules from where he sits. And the council has really taken action to, 6 months ago or something, to make sure that his orders also had the force of law and ordinance in the city. So I want to ask the city attorney, Ann Morgan, can you speak to the orders and the standing of those orders and what they say now?
Sure, Mayor. As you referenced and as Dr. Escott referenced earlier, Council back in July passed an ordinance which we can do as a home rule city and pursuant to the Texas Health and Safety Code, which authorized Dr. Escott as the health authority to enact rules. And he did that, and those rules are still in place. They've been in place since July. They were re-upped. The ordinance was re-upped in December. The health authority rules are in place until April, so till next month. They're related to COVID-19, and they allowed Dr. Escott to enact rules that are reasonably necessary to protect public health as it relates to COVID-19. And so they apply to both individuals and sites. They require a Class C misdemeanor that's punishable by a fine up to $2,000. The actual fine will be determined by a judge or a jury in municipal court. The health authority rules will be enforced by the same departments that have enforced the mayor's rules for the past year. Of course, our first step always is education. And then if there are subsequent verified complaints, then it would result in criminal penalties. And so if somebody has a complaint, they could refer them to 311. And the general description are similar to the things that the orders have been about from the mayor. They require face coverings. They limit the number of people who can gather together. They require physical distancing, so the 6 feet apart issue. And then there's some specific things about if people test positive or in a household, people who test positive, what happens there. There's some specific pieces of information about childcare facilities, schools, construction sites, that type of thing. So our recommendation is that we shift from the enforcement of the mayor's orders as you just described and move over to Dr. Escott's health authority rules, which again have been in place for quite some time now.
Okay, thank you. We're so close to moving into a place, as we see now, where more normal lives can return, and I appreciate the consistency that our doctors and data drive us to, and I'm pleased to hear that direction continue. Judge Brown, those are all the questions from the City Council here on this run.
Thanks.
On this round.
We're a little past 11, so I think we have hit our time. If you want to, I just thank you, Director Hayden, thank you, Dr. Escott, and thank you, everybody, for all of your efforts on ramping up the capacity to vaccinate people in Travis County and Central Texas region. We're in a race against the virus and its mutations, and we have to do everything possible to make sure that we are getting the vaccine out as quickly as possible and that we're building capacity to give out more so that we will get more vaccine whenever it is available. And I think really impressed by the team effort to work on that. So I'll hand it back to you, Mayor, if you want to adjourn, and then I will come back here and adjourn.
Okay, I'm going to close this out. Ann, I see you have your hand raised. We don't have time for any more questions at this point. That was our deal with the county. So we'll just go ahead and close this out. It is 11:11, and I'm going to adjourn the City Council's participation in the joint special called meeting with Travis County. We're going to now go as a council back to the city council meeting on the other channel, and we'll convene that. And I think then we go into executive session. Is that the way to handle that, Ann? To convene the meeting, then we'll go into...
That's correct. You should exit this meeting and reconvene a council meeting for yourselves.
Okay, so we'll do that in 5 minutes. I'll see you guys there. Judge, and to the Commissioner's Court, thank you for letting us participate with it.
Thank you, Mayor and City Council members. And so without objection, I'm also going to adjourn the meeting of the Travis County Commissioner's Court, and we will come back in 5 minutes. So we're going to adjourn.
Ring a